Although your workplace will usually present a safe and secure environment, it's important to remain aware that a sudden injury or illness can afflict anyone in your place of work at any time. Knowing how to calmly respond to any sudden accident is a crucial aspect of your role as employer or employee. Health and safety regulations require that a minimum first aid provision is made in every workplace. There must be at least one person on the premises responsible for and with a basic knowledge of emergency first aid. This person is called an appointed person. An appointed person may also be a qualified first aider, which means they hold a current First Aid at Work certificate and have undergone an HSC-approved training course. There should also be a suitably stocked first aid box maintained and administered by appointed persons. You must be aware that your first aid skills may be called upon to respond to any sudden injury that should befall a visitor, contractor, or another member of staff. You should be familiar with the health and safety risk assessment of your workplace and consider your approach to first aid based on the layout of the site or premises and any potential hazards within it. This video aims to provide guidance on how best to respond to sudden illness and injury in your workplace and offers advice on correct procedure. However, when dealing with any situation that requires emergency first aid, you must be aware of your limits and not attempt to administer first aid for which you have not been trained. The first step in applying emergency first aid to an injured person is to assess the situation. Make sure that it is safe to approach the casualty. You will be of no use if you are injured through failure to notice potential hazards. For example, check that there are no electrical hazards, gas or broken glass in the area, and that the cause of injury does not pose a continuing risk to either you or the casualty. If you do identify any dangerous elements, assess whether these can be safely removed. Others can be asked to make the area safe while you attend to the injured person. When you are satisfied that the situation is safe, the next step is to make a brief assessment of all casualties. If the casualty has fallen, or if there is a reason to believe that they have suffered head or neck injuries, you must not move them unless absolutely necessary. Assess whether the casualty is visibly conscious. If you cannot see that they are conscious, gently shake their shoulders and try to provoke a response.
Hello? Hello, can you hear me?
If the casualty is unresponsive, they should be considered unconscious. Always deal with unconscious casualties first, following the adult basic life support sequence. If the casualty does not respond, the first thing you have to do is to shout for help. Next, turn the victim onto their back, and then open their airway using head tilt and chin lift. Place your hand on their forehead and gently tilt their head back. If you suspect that the head or neck may be injured, handle the head with extreme care and tilt it back only very slightly to open the casualty's airway. Keeping the airway open, look for chest movement. Listen at the casualty's mouth for breath sounds and feel for air on your cheek. Look, listen, and feel for no more than 10 seconds to determine if the casualty is breathing normally. If you have any doubt whether breathing is normal, act as if they are not breathing. If the casualty is breathing normally, first turn them into the recovery position, and then send or call for an ambulance. Check for continued breathing until help arrives. If the casualty is not breathing normally, first ask someone to call for an ambulance. If you are on your own, call the ambulance yourself. You may need to leave the casualty. Next, start with a cardiopulmonary resuscitation, also called CPR. Kneeling down, place your hands in the center of the victim's chest and interlock your fingers. Do not apply any pressure over the upper abdomen or the bottom end of the bony sternum, the breastbone. Position yourself vertically above the casualty's chest and with your arms straight, press down on the sternum 4 to 5 centimetres. After each compression, release all the pressure on the chest without losing contact between your hands and the sternum. Repeat at a rate of about 100 times a minute, a little less than 2 compressions a second. Remember that compression and release should take an equal amount of time. After 30 compressions, open the airway again using head tilt and chin lift. If you are alone, proceed with rescue breaths. If you have a protective mask, place this over the victim's mouth and nose. Take a normal breath and place your lips around their mouth, making sure that you have a good seal. Blow steadily whilst watching for their chest to rise. Take about 1 second to make their chest rise, as in normal breathing. This is an effective rescue breath. Take your mouth away from the casualty and watch for their chest to fall as air comes out. Take another normal breath and blow into the casualty's mouth once more to give a total of 2 effective rescue breaths. Then proceed with a further 30 chest compressions. Continue with chest compressions and rescue breaths in a ratio of 30 to 2. Stop to recheck the casualty only if they start breathing normally. Otherwise, do not interrupt resuscitation. If your rescue breaths do not make the chest rise as in normal breathing, check that you are keeping the nostrils completely closed, that you are making a tight enough seal, and that the head is tilted back far enough. Check for obvious obstruction to the airway. However, you must not use your fingers to feel blindly down the throat. Do not attempt more than 2 breaths each time before returning to chest compressions. If you are not able or are unwilling to give rescue breaths, give chest compressions only. These should be continuous at a rate of 100 a minute. You must continue resuscitation until qualified help arrives and takes over, the casualty starts breathing normally, or you become exhausted. Always stay with the casualty until medical help arrives. If your initial check shows that an unconscious casualty is breathing, they will need to be placed in the recovery position. Kneel beside the casualty and remove any bulky or fragile items from their pockets, and take off their glasses and keep them safe. Check that the casualty's airway is still open and straighten their limbs. Place the casualty's nearest arm at right angles to their body. Bring the casualty's farthest arm from you across their chest, placing the back of their hand against their cheek. Hold their hand in place and, using your free hand, pull up their far leg just above the knee, keeping their foot on the ground. Keeping the hand against the cheek, pull on the far leg to roll the casualty towards you onto their side. Ensure that the airway is still open and bend the casualty's upper leg at the knee so that both the hip and the leg are at right angles to the body. You must be aware of the risk that they may have broken bones or suffered head, neck or spinal injury. If you suspect that such injuries have occurred, do not move the casualty. When dealing with a visibly conscious casualty, you should treat the injured person immediately and then call for an ambulance if necessary. The results of your initial assessment of an unconscious casualty will tell you when is the right time to call for an ambulance. If another person is present, you should ask them to telephone an ambulance immediately after you have made your assessment. If you are alone, we have already noted that the condition of the casualty will determine how you respond and when to place a 999 call. In cases of cardiac arrest, you should telephone for an ambulance prior to administering CPR.
Can you call an ambulance, please? I have an unconscious, breathing male, approximately age 30.
Okay.
Whether it is you or a helper that calls for an ambulance, you should adhere to the following procedure.
Ambulance, please.
Call 999 and ask for the ambulance service. Give your telephone number and the exact location of the incident, including details of landmarks and junctions, to help the ambulance respond quickly. Give details of the nature and seriousness of the incident. Give the number, sex and ages of all casualties and anything that you know about the nature of their condition. Communicate the findings of your situation, casualty and assessments of consciousness. Include any potential hazards and note what action, if any, you have already taken. You may be required to stay near the telephone to provide further information to the emergency services. If you have delegated the call to another person, make sure that they understand the telephone procedure and that they report back to you after making the call.
Ambulance is on its way.
Heart attacks most commonly occur when the blood flow to the heart is obstructed. The victim of a heart attack will usually experience a vice-like chest pain, which can often spread to the jaw and down the left arm. The casualty will also exhibit signs of anxiety, breathlessness, and a sudden acute weakness. The casualty can turn very pale, and the lips may appear to be slightly blue in colour. You should also be prepared for a sudden collapse.
Martin, is everything all right? Let's sit you down.
When recognising the symptoms of a heart attack, your first response should be to try and relieve the strain on the heart. Help the casualty to sit down and support their head, shoulders and knees. Some people may have tablets or a spray to treat angina. Allow them to administer their own medicine, but prevent them from drinking fluids. Do not give the casualty any medicine. This should only be done by a qualified person. If the symptoms persist beyond a few minutes, you should telephone for an ambulance and tell the controller that you suspect a heart attack. A heart attack can sometimes develop into a full cardiac arrest. If the heart attack victim loses consciousness, it may be that their heart has stopped. In this instance, you should make a quick assessment. If there are no signs of breathing, you should suspect cardiac arrest, and your first response should be to make an immediate call for an ambulance.
Can you call me an ambulance, please? I have a non-breathing, unconscious, middle-aged man and I need a time on the ambulance.
If a helper is contacting an ambulance, you should commence CPR. If you are alone with the casualty, you must telephone for an ambulance and inform the controller of the arrest before returning to the casualty to commence CPR. Your first response to severe bleeding should be to gain access to the wound and apply pressure as soon as possible.
Michael, is everything all right?
I've cut my hand on some glass.
Let me see.
If you can, it is advisable to use disposable gloves when treating the wound. Remove or cut all clothing surrounding the wound. Apply direct pressure to the wound using your palm or, as soon as available, a sterile dressing. Be careful of sharp or dangerous objects embedded in the wound. However, you must not remove such objects. If there is an object stuck in the wound, you may still apply pressure by pressing the edges around it. If possible, raise the injured part above the level of the heart and continue to apply pressure for 5 to 10 minutes in order to allow the blood to clot. Be careful to handle the injured part gently to prevent disturbing any possible fracture and to help minimize shock, and apply a sterile dressing over any original pad. Make sure that the dressing is tight, but not so tight as to hinder circulation. If there are objects within the wound, you should build up the padding on either side of the object until a bandage can cover it without pressing. Telephone for an ambulance and report the nature of the injury and the extent of the bleeding. In the event that the casualty loses consciousness, you should perform a quick assessment to check that they are still breathing. Some casualties may experience shock, which you should treat after dressing the wound. Make sure that you wash your hands thoroughly and remove all blood from your person after administering treatment. Shock can occur as a result of heart attack, blood or fluid loss, and burns. It can lead to serious organ failure if not treated quickly.
Listen close, okay? I need you to keep your hand up, okay?
A little bit thirsty.
Okay.
How is he?
I need a blanket, a towel, and something to raise his legs on, okay?
Okay.
Sorry. I just need to get that up, okay?
The initial symptoms of shock are usually characterized by a rapid and weak pulse, a pale skin color, sweating and cold, clammy skin. As the shock develops, the casualty may experience weakness, nausea, thirst, and rapid, shallow breathing. If the shock worsens, the casualty will become restless and may start gasping for air or begin to lose consciousness. Serious shock can also lead to cardiac arrest. If you recognize signs of shock, your first response should be to treat its cause. For example, applying emergency first aid to severe bleeding. You should then attempt to improve the supply of blood to the vital organs by lying the casualty down and loosening any tight clothing. Place a blanket beneath the casualty to protect them from the cold ground. Keep their head low and raise and support their legs as high as possible. Constantly reassure the casualty, but do not leave them alone or allow them to eat, drink, move or smoke. Undo anything that constricts the neck, chest and waist and keep the casualty warm. You should call an ambulance as soon as possible and record breathing, pulse and level of response every 10 minutes until medical help arrives. If the condition worsens and the casualty loses consciousness, you should perform an assessment and commence the resuscitation sequence if necessary. Food, sweets or small objects can become lodged in the airway if they are accidentally breathed in instead of being swallowed. Some possible signs and symptoms would be that the casualty may have difficulty speaking or coughing. They may grasp their throat and have a contorted face. In later stages, the skin could become pale with a bluish tinge, and ultimately they may become unconscious.
Martin. Can you cough, Martin? Martin, can you cough?
Firstly, encourage the casualty to cough. If the choking is mild, this will clear the obstruction.
Martin, can you cough?
If the obstruction is not cleared, shout for help, but do not leave the casualty. Bend the casualty forward and give a maximum of 5 back slaps with the palm of your hand between the shoulder blades. If the obstruction is not cleared, apply abdominal thrusts by standing behind the casualty and placing both your hands around their waist. Make a fist with one hand and place it midway between the belly button and base of the breastbone with your thumb inwards. Grasp your fist with your other hand, then pull sharply inwards and upwards. Do this up to 5 times and stop if the obstruction is cleared. If it is not cleared, keep repeating the cycle of back slaps and abdominal thrusts while someone calls for an ambulance, but don't interrupt this cycle whilst the casualty is still conscious, until the blockage clears. If the casualty becomes unconscious, administer CPR. After successful treatment, the casualty should be advised to see a doctor.
Tony, what's happened?
I fell off that ladder and I put my arm out to stop myself falling and I think I broke it.
Okay. All right, can you bend it?
I don't know.
You should not allow a casualty suffering from a suspected fracture to have anything to eat or drink. You should avoid moving the injured part unless absolutely necessary. Assist the casualty in supporting the injured part, making use of padding where helpful. Keep the limb in position. If the fracture appears to be minor, arrange for the casualty to be transferred to hospital according to your organisation's policy. If you suspect a more serious break, you should call for an ambulance. If the fracture occurs to the facial area, you should make sure that the casualty's airway is open and place them in the recovery position before calling an ambulance.
Michael, what's happened? Where's the pain?
The bottom of my back.
A pain in the back or neck, irregularity in the curve of the spine, or tenderness of the spine to touch may indicate back injury. If the casualty is also experiencing difficulty in breathing and loss of control or sensation in the limbs, you should suspect serious back injury. It is important not to move the casualty from the position in which you found them, unless they become unconscious. Your first response should be to reassure the casualty and tell them not to move. You should keep the casualty's head, neck and spine aligned by placing your hands over the casualty's ears and holding their head still. You can ask a helper to place padding around the casualty's head and shoulders and then immediately summon an ambulance. You must keep holding the casualty's head at all times until medical help arrives. If the casualty loses consciousness, you should proceed with an assessment. Handle the head with extreme care and tilt it back only very slightly to open the casualty's airway. Dry and wet heat, such as flames or hot liquid, are not the only causes of burns and scalds. Chemicals, electricity and friction are also all common causes of burns. Before treating a burn, you should make an assessment of the situation and be satisfied that the cause of the burn does not present a further hazard. You should then assess the seriousness of the burn, its cause, and whether shock is likely to develop. If the casualty is in an area where smoke or fire still presents a hazard, you should remove the casualty from danger and call the fire brigade. Your priorities when treating a burn are to stop the burning, treat swelling, blistering and pain, and minimise the risk of infection. You should also be prepared to recognise and treat any symptoms of shock.
It's going to be fine. We just need to run it under some water. Come with me.
Your first response should be to cool the burn. Make the casualty comfortable and pour cool water on the burn for at least 10 minutes. Gently remove any tight clothing or jewellery from around the burn before the injury begins to swell. You must not apply lotions or ointments to the burn, or remove any material that may be sticking to the injured part. Similarly, do not touch the burn, burst blisters, or in any way interfere with the injured part. If the burn is chemical, you should hold it under cool, running water for at least 20 minutes. Next, you should cover the affected area with a sterile dressing or clean piece of material. Cling film is ideal. Reassure the casualty and either take them to hospital or call an ambulance. Incidents of crush injury are most common on building sites, in warehouses, and around traffic. Crushing will usually involve fracture and swelling, and may include internal bleeding and disrupted circulation. If the casualty has been crushed for less than 15 minutes, you should quickly release them from the crushing force if safe to do so. You should suspect fracture and treat the casualty for shock before calling an ambulance. If you are called to treat a casualty that has been crushed for more than 15 minutes, you should not release them. Poisonous toxins may have built up in the victim's body, which paramedics will have to neutralise. Your priority is to summon specialist medical help as soon as possible. Call an ambulance before reassuring the casualty and recording level of response, pulse and breathing every 10 minutes until medical help arrives. Concussion is incurred through injury to the head and may lead to impaired consciousness. Your first response in treating concussion should be to assess the casualty. If they appear groggy but respond to sound or pain, you should reassure them and make them comfortable until they have recovered. If they do not fully recover, or if their level of response deteriorates, you should call an ambulance. As soon as the casualty has recovered, you should place them in the care of a responsible person, with instructions for their condition to be monitored. You should advise the casualty to go to hospital, in line with your company's policy, if they later experience headache or nausea. If the casualty is unconscious, you should follow the procedure for treating an unconscious casualty, but remain aware that they may be suffering from head or spinal injury, as well as fracture. Always call an ambulance.
Michael, can you hear me?
Diabetes is a condition in which the pancreas is unable to properly regulate blood sugar levels. Diabetics can suffer from either hyperglycemia, which is prolonged high blood sugar, or hypoglycemia, which is caused by a fall in blood sugar levels. Hyperglycemia can prompt unconsciousness and even diabetic coma. Sufferers will exhibit symptoms of rapid pulse and laboured breathing, as well as dry skin, a faint smell of acetone on the breath, and excessive thirst. You should telephone for an ambulance as soon as you recognise someone is suffering from hyperglycemia.
Can someone call an ambulance, please? And I need a jug of water as quickly as possible.
Assess an unconscious casualty before placing them in the recovery position and recording their condition every 10 minutes until medical help arrives. Hypoglycemia is often characterised by faintness, dizziness, confusion, shallow breathing and sweating. You should help the casualty to sit down and give them sugary drinks and sweet food to try to raise their blood sugar level. If the casualty becomes unconscious, you should proceed with an assessment, call an ambulance, and record pulse and breathing until medical help arrives. It is important to be acutely aware of the difference between hyperglycemia and hypoglycemia. Mistaking the two and administering sugars to someone suffering from hyperglycemia could induce diabetic coma. Splashes of chemicals in the eye can cause serious injury if not treated quickly. Scarring and blindness can result if the surface of the eye is damaged. People suffering from a chemical splash to the eye will usually be affected by intense pain and may experience redness, swelling, and copious watering of the eye. They may also be unable to open the injured eye. Do not touch an injured eye or allow the casualty to rub it. Your first response should be to irrigate the eye as quickly as possible. Wearing protective gloves, you should lie the casualty on their back, keeping their head still by supporting it on your knees. Tilt the head in the direction of the injured eye and irrigate the eye from the nose outward using clean, cool water. Be careful that contaminated water does not splash either the uninjured eye or yourself. After 10 minutes of irrigation, you should tell the casualty not to move either eye and ask them to hold a sterile dressing or clean pad over the injured eye, keeping the uninjured eye closed. You should then identify the chemical involved and call for an ambulance.
You okay, Martin?
Starting to have problems with my breathing.
All right, stay there. I'll go get Kate.
Allergic reaction in a severe form may rapidly develop into anaphylactic shock, a serious, potentially fatal condition. A person suffering from an allergic reaction may exhibit a widespread rash or a red, blotchy skin eruption. Their face and neck may begin to puff and swell, and they may begin to experience difficulty in breathing.
Hi, Martin. How are you feeling?
Not very well. My lips are tingling. I'm having problems breathing. And I can't swallow very well.
How long have you felt like this?
10 minutes.
Your first response to an allergic reaction should be to call an ambulance and give as many details as possible on the casualty's condition and the possible cause of the reaction. You should sit the casualty down to assist breathing and check whether they are carrying a syringe of adrenaline. Help the casualty to administer their own adrenaline if necessary, but do not give an injection yourself unless you have been specifically trained to do so. You should record breathing, pulse and level of response every 10 minutes until medical help arrives. If the casualty becomes unconscious, you should make an assessment and be prepared to administer CPR. When treating a casualty who has swallowed poisons, you should not try to induce vomiting. Your first response should be to reassure the casualty and find out what they have swallowed before calling an ambulance. Give as many details of the poison as possible to the ambulance controller. It's especially helpful to have the poison's container close at hand when calling the ambulance, as you may be asked to read information from the label. If the poison is corrosive, give frequent sips of milk or water. The first aid box should be located in a clearly marked and accessible place within the workplace. The box should contain any items that you deem necessary, having assessed the needs of your workplace. It should have a minimum stock of a leaflet giving general guidance on first aid, 20 individually wrapped sterile adhesive dressings or plasters, 4 individually wrapped triangular bandages, 2 sterile eye pads, 6 safety pins, 6 medium-sized individually wrapped unmedicated wound dressings, 2 large-sized unmedicated wound dressings, 1 pair of disposable gloves. The first aid box should not contain tablets, medicines, or any items that the appointed person has not been trained to use, and should be regularly checked and restocked by the appointed person. It is of central importance to your first aid provision that you maintain a record of any illness, accident, and injury to have occurred in your workplace. You must keep a record of every incident, no matter how minor. Even a small cut that was treated by applying a plaster must be written down. Records should include date, time and place of incident, the name and status of the casualty, details of the injury or illness and what first aid was given and offered, what happened after first aid treatment. For example, did the casualty go to hospital? Name and signature of the appointed person that dealt with the incident. Keeping a record of illness and injury will help when reviewing your workplace's health and safety risk assessment. It is also an important document for insurance purposes. You should now have a good understanding of basic first aid techniques and their associated issues. Make sure that you approach all incidents calmly and follow procedure from assessment through to treatment. Familiarise yourself with the location of the first aid box and the detail of your workplace's health and safety risk assessment. Remember to always keep accurate records of any illness or injury and never attempt to perform first aid for which you are not appropriately trained.